My name is Dr. Todd MacGregor. I'm a pediatrician practicing in Oakville, Ontario. I practice consulting general pediatrics. Consulting pediatrics is a specialty that sees children from birth to age 18. We see kids through the age spectrum with a variety of different problems or concerns. The issues are usually referred to a pediatrician by a family doctor. Many kids see a family doctor for their primary care, and when a family doctor or a parent is perplexed or concerned about an issue, they would often be referred to a pediatrician for further assessment and management of the issue at hand. I provide consulting care, so I don't provide primary care to patients, so they're referred to me by their family doctor, and I see them for whatever the health issue is. That may be one visit that effectively assesses and deals with the issue, or it may be through the lifespan of that child, depending on what their concerns are. Some kids with complex medical needs might see me regularly until their 18th birthday, and I see them often together with their family doctor, and rarely I would see them as their only doctor. Typical patients that I see are very dependent on the age of the patient. I may see a young baby who is born prematurely and needs to have ongoing follow-up of growth and development. I may see a premature infant who is quite sick and has complex needs that puts them at risk of various health issues and developmental delays over their life. They need monitoring, they may need referral to subspecialists, they may have issues related to their feeding and growth. And then with older kids, I may see them for developmental issues. Often in the age between 1 and 4, kids progress quite quickly in their development and may have issues ranging from language and communication to motor skills or autism. So they might see a pediatrician for assessment of the issues, whether there's an underlying cause, what treatment needs to be laid out. Then I may see older kids with various health complaints, sometimes very non-specific things like headaches or tummy aches, to more serious things that might include concern with lumps or bumps and cancer, to epilepsy, asthma, to name a few. Some children have school or behavioral problems and might see a pediatrician for assessment of what possible causes and possible treatment options are. I see these kids often 1 or 2 visits or many visits, depending on how I see the issue going forward and what follow-up needs to be made. So the process of getting an appointment with me involves a referral from a physician. Typically that's the child's family doctor. Sometimes the referrals come from an emergency room or a hospital. And once a referral is made, I generally look at these referrals, triage them, meaning assess their priority. So if a problem seems urgent, I might see the kid within a few days to a week. If the issue is less urgent, it may take up to a few months to get an appointment with me. And that's all based on my time availability and the priority I place on the issue at hand. Another role that a pediatrician often has is hospital-based care. I provide hospital services at Oakville Trafalgar Hospital. That involves caring for patients, of course pediatric patients from birth to 18 years of age in the hospital, ranging from assessing children on a consulting basis in the emergency room, attending deliveries to look after babies, if there are concerns of fetal health or prematurity, caring for infants in the nursery once they're delivered, and if they are unwell, or caring for inpatients on the pediatric ward, as well as an outpatient pediatric clinic.